Let's learn few important topics for Neet PG. Abundant lanugo is present in premature baby. Then next is diabetes versus post maturity baby. There are many things in common, like when you look about the electrolyte disturbance, hypoglycemia, hypocalcemia, then there will be polycythemia. One important difference that you can find between them is in diabetes polyhydramnios and post maturity there will be oligohydramnios. Next is breast milk storage. So breast milk storage in room temperature, the mnemonic is 8 into 3 is equal to 24. So 8 into 3 is equal to 24. So room temperature you can keep it for 8 hours. Then if you are keeping in the refrigerator, then 8, then 24 hours. Then next is freezer, 3 months. Critical limb ischemia, that is when ABPI less than 0.4. Acetohydroxamic acid for treatment of struvite stone. Treatment of sacrococcygeal teratoma is radiotherapy. Then next is hepatic venous pressure gradient. So that is, remember mnemonic is Wi-Fi. So Wi-Fi is wedge hepatic pressure minus 5 free hepatic pressure. That difference is hepatic venous pressure gradient. Transpulmonary means intraalveolar and intrapleural, in difference of that too. Mineralocorticoid receptor is located everywhere, even most of the places in GIT, including the parotid, kidney, gut, also in the brain pituitary, but exception is liver. Then the ion which is determining resting membrane potential is potassium. So if there is a high potassium elevated, then RMP becomes more positive. Low potassium RMP becomes less positive, more negative. Normally the RMP is minus 70 millivolt. For potassium it is actually around minus 90 millivolt. So it is near to that. Then next is baroreceptor will be active in which range of mean arterial pressure. So it is more sensitive to pulse pressure than mean arterial pressure. So 120/80, this is 70 to 110. For that, in that range it is active. Normal BP 120/80. So just you subtract 10, you get 70 and 110. So that range baroreceptor will be stimulated in that range of mean arterial pressure. Then next is gastric emptying. So next is gastric emptying. Gastric emptying and this baroreceptor reflex, the mechanism of action is to decrease BP. So what happens is it is actually stimulating. So what happens in baroreceptor reflex is, in baroreceptor reflex it has to decrease the BP. So when the BP, mean arterial pressure, around 70 to 110, it this gets activated. So the initial step is stimulation of nucleus tractus solitarius, thereby inhibiting the sympathetic system, which is rostroventrolateral medulla, and also stimulating the cardio CVC vagus center. Parasympathetic is activated, sympathetic is inhibited. Ultimately, the BP will fall. The next is gastric emptying. Now we have to know the factors which are affecting the gastric emptying. Gastric emptying is increased by parasympathetic motilin, and also which type of food it is, mainly carbohydrate food, and tonicity, isotonicity, and also stomach distension, then it will be easily emptied. Whereas the opposite things, sympathetic will decrease emptying, and regarding the type of food items, fat and proteins will be less uh, emptied, less. It takes more time to empty. Gastric emptying is less. And then next is about the uh, also the tonicity, hypertonicity and hypotonicity both. Then when the distension is in the duodenum, or when there is acidic chyme in the duodenum, it is inhibiting the gastric emptying. Then next is best method to teach illiterate people. You can demonstrate. Suppose if you are given a method of cutout of some pictures, and you are teaching some students of you are introducing that to some children of that village, it will be chalk and talk method. When it has to be a poster, means it should be a mass communication to many people, then only you can call it as poster. Then next is a Red Cross headquarters at Geneva. Mass chemoprophylaxis. In case of a cholera outbreak, you can give only 2 household contacts. It's enough. Number of days in equation of maternal mortality rate. So one is maternal deaths, or it can be after termination of pregnancy, like within 42 days. Who select village health guide? It is MO medical officer. Then polyuria. A case of a polyuria, then it can be central diabetes insipidus and primary polydipsia and nephrogenic diabetes insipidus. So when you look at the level of ADH level is less than 1, and the urine osmolality is less than 300. So ADH is low and urine osmolality will be low. Then it can be either a central diabetes insipidus or primary polydipsia, and the differentiation can be done from MRI whether there is bright spot or not. If the ADH value is more than 1 and the urine osmolality is more than 300, then it is nephrogenic diabetes insipidus. Pre-renal AKI. Pre-renal AKI is in fractional excretion of sodium less than 1, urine sodium is less than 20, blood creatinine by plasma creatinine more than 20, urine creatinine by plasma creatinine more than 40, urine osmolality more than 500. So it's easy to remember: less than 1, less than 20, more than 20, more than 400, more than 500. Voyeurism BNS is 77, sagittal suture then a closure, age will be 60 years. Worsening catatonia is antipsychotics. So post-traumatic catatonia is relieved by lorazepam, whereas exacerbated by giving antipsychotics. Then like atypical antipsychotics. So post-traumatic stress disorder is done after a duration. You can diagnose after a duration of only 1 month. Before that, if the question, then it can be like acute stress reaction, like that. Investigation of choice for slipped capital femoral epiphysis is MRI. Fat pad sign is in type 1 in Gatland classification. So undisplaced and stable fracture of this femur neck. In that case, what you have to do, if it is stable, then okay, dynamic hip screw. But if it is unstable and that is displaced fracture, then proximal femoral nail. So management of developmental dysplasia of hip, it can be less than 6 months, 6 months to 18 months, then to 3 years. So in a very small age, what you can do is Pavlik harness, then hip spica, and after like 3 years and all, like after 1.5 years, then you can do osteotomy. So next is, what is the treatment of choice in aspergillosis? Ultimately, okay, you can do endoscopic excision surgery, FES. Rhinosporidiosis also it is excision, that is surgery, that is the main treatment. But medical management you can definitely give in both. Aspergillosis, it's voriconazole. Rhinosporidiosis, dapsone. Nasopharyngeal carcinoma, stage 1 and 2. Stage 1, you can, it is 1 and 2, it is mainly chemotherapy. Mainly radiotherapy, radiosensitive, but 3 and 4 chemoradiotherapy. Then juvenile nasopharyngeal angiofibroma, it is mainly you have to do is a surgery, excision of that. Whereas if it is intracranial or recurrent, then radiotherapy. Teflon paste is used in which ENT condition, atrophic rhinitis. First investigation for diagnosing multiple myeloma electrophoresis. Best investigation is bone marrow biopsy. Mineralocorticoid receptor blocker decrease mortality of heart failure. So you have to remember heart failure mortality decreasing drugs. There is like a beta blocker, AC inhibitors, so A, B. Then calcium channel blockers like amlodipine, they are not there. Now other drug which is mineralocorticoid receptor blocker and new drugs like SGLT2 inhibitors, ARNI, all those. Management of asthma. So if there is day symptoms alone and no night symptoms, you can give just SOS inhalational steroid. Whereas if it is along with the night symptoms also, then definitely daily you have to take a steroid and formoterol. Then next is the curve. The question is actually to identify which is inspiration, which is expiration. Inspiration is below, expiration is above. Above. Ondine curves, we are seeing ondine curves in lesion in where? Lesion in medulla. That patient has to breathe voluntarily only, which is absolutely not. It's a theoretical concept, not practical, but still you have to know that. If the lesion is above pons, then cortical control is gone. In that case, still that breathing will be regular only. Ondine curves is here in medulla. Here the problem is involuntary portion is gone. You can take breathe voluntarily. Then infusion of sodium chloride. This graphs here you can see the tonicity is increased. Sodium chloride infusion and also diabetic insipidus, but you can see there is a contraction from different spaces. In sodium chloride, when you are giving the ECF, the fluid is first in the ECF, so ECF is expanded. In diabetic insipidus, so in diabetes insipidus there is a contraction from both, because so much of water is eliminated. So both ICF from ECF initially, then ICF, so that what happens ultimately, it becomes concentrated in plasma. Now in case of SIADH, what happens in SIADH, it is the ADH is very high, so more water retention, so especially in ICF, so that's why you can see. And since there will be dilutional hyponatremia, the concentration will become slow, everything is diluted, so low. Adrenal insufficiency also, it will be low. It will be low, and there will be increase in ICF and reduction from ECF. Then next is anterior hypothalamic nuclei and posterior. So posterior is causing shivering in response to cold. So anterior it's opposite. Fast pain is A delta, slow pain is C. That is postganglionic sympathetic fibers. If you are not able to see object, then that is visual cortex area number 17. You can see but not recognize 18 and 19. That is the association areas. What happens to resting membrane potential? We already told it is mainly determined by potassium. If potassium high, more positive, low, less positive or more negative. Now good prognostic factor in neuroblastoma. In neuroblastoma, it is hyperdiploidy. Okay. Defective DNA cross-link repair seen in Fanconi's anemia. Adam TS13, it is also called as, what is the other name of that? So that is in TTP. It is also called a von Willebrand factor cleaving protease. Then Lederer Sieve disease. So and Hans-Schuller Christian. How to differentiate is Schuller remembers skull. So skull may feel lesions like a exophthalmos, diabetes insipidus, all that will be there. And lytic lesions in skull. Now granulation tissue. Granulation tissue formation is inhibited by TGF beta and the granulation tissue formation is stimulated by fibroblast growth factor whereas inhibited by TGF beta now so that fibrosis occurs. MCV, MCH, MCHC. MCV is PCV by RBC count. MCH is HB by RBC count. MCHC HB by PCV. The next is naive B cell. So you have to know what is originating, which cell lymphoma. Naive B cell it is mantle cell lymphoma. So N naive, you just remember NAM. So mantle cell lymphoma, germinal or post-germinal, that is follicular diffuse large B cell, memory B cell, that is marginal, hairy cell leukemia, all those. Then tensor facial lata, that is causing that is the relaxation of the abdomen when your flexion of the hip by contracting tensor facial lata. Faber, flexion, abduction, external rotation. Flexor pollicis, so these are actually which type of muscles? Flexor pollicis longus, most of the upper limb it is unipinnate. Flexor pollicis longus unipinnate, hallucis longus bipinnate, peroneus longus and tertius. So you know that longus is the bigger one, tertius is unipinnate, longus is bipinnate. Triangular muscle is trapezius, multipinnated deltoid. Radial of circumpinnate is tibialis anterior. This is the posterior relation of kidney in the order SP, that is S. First of all adrenal, then spleen, stomach, pancreas, small intestine, large intestine, and the side one, that is jejunal flexure. On LA of sacrum, the order is from lateral to medial, oils. Obturator nerve, iliolumbar artery, lumbosacral trunk and sympathetic chain. Oils from lateral to medial. Then inferior root. So answer cervicalis, inferior root and superior root. Inferior root is supplying the definitely omohyoid, it will be there. Inferior belly, superior belly. Other than that, inferior root sternohyoid, superior root sternothyroid. H is near to I, T is near to S. Exception to the sense of cervicalis, that is thyroid. Next is SDH resistant gastrointestinal stromal tumor. So you know it is imatinib is the treatment, but if it is SDH resistant, it's not responding to imatinib, and for other normally in just you are not, it is not responding to radiotherapy. In MES score, limb salvage is possible if less than 6. We got MES roll from the above, that is the upper pole ureter will go inferomedial, more distance, and the lower one superolateral, less distance. This longer one is creating the problem. Interferon beta used in multiple sclerosis. Then next is, you can see antibiotic. This is actually to identify the graph. So when you have an antibiotic action constant when cross a minimum concentration, it is time dependent killing, but the concentration increases the effectiveness of killing, that is concentration dependent killing. So the concentration is increasing. Then you have to know the examples for time dependent killing: beta-lactam, vancomycin. Fluoroquinolone aminoglycoside is concentration dependent killing. Organophosphate is binding to esteratic site of acetylcholine esterase. 50S subunit is binding to, so 50S subunit binding to cells, so it is chloramphenicol, then macrolide erythromycin, lingosamides, that is clindamycin, and linezolid, streptogramin, dalfpristine, quinpristine. IMP dehydrogenase enzyme inhibitor is, so this is ICMR, I for IMP dehydrogenase enzyme inhibitor cyclophosphamide, calcineurin inhibitor cyclosporin tacrolimus, mTOR inhibitor sirolimus everolimus, used to relieve priapism, that is phenylephrine. So phenylephrine is alpha agonist used to treat priapism. Priapism can occur when there is congestion of this blood, so it will induce vasoconstriction. Evolocuzumab, PCSK9 inhibitor. Bishop score 1. So Bishop score 1 is in dilatation 1 to 2 plus. So that is actually the confusing one, dilatation and length of cervix. So length of cervix, it will be 3 to 4. Just study one, that is dilatation 1 to 2. Bishop score 1. HER2 new 1 plus. So 1 plus means negative, so nothing to do. Retrosternal goiter. So in retrosternal goiter, indication of sternotomy is to do sternotomy, then it should be beyond the aortic arch and also malignant. In such case only we do. If it is above the aortic arch, or if it is benign, then mostly we do from sternal incision only. Claudication pain in buttocks, then it can be from occlusion in aortoiliac. Thigh, then iliac. Calf, femoral. Thigh has I, so iliac. Calf, F for femoral. Indication of radiation in basal cell carcinoma only when it is away from the vital structures. If it is near to vital structure, Mohs only. And if it has eroded cartilage or bone, then radiation is contraindicated. Then branchial cyst is arising from second cleft. First pouch, we already studied tympanic cavity, eustachian tube. So this is very important, that 1 to 2 is screening time, whereas 1 to 3 is late time. Do not show iceberg phenomenon, that is tetanus, rabies and measles. Measles do not show iceberg phenomenon. The children will have rashes and all, fever with rashes, so do not show iceberg phenomenon. Prescriptive screening and selective screening. So prescriptive means when a patient comes, in order to diagnose, we give this prescriptive screening. Selective means suppose a patient was detected diabetes, if it is a high risk family, we look for them, that is selective screening. Cyclical trend. So cyclical trend means in some times, like weekends, RTS or more, that is cyclical trend. Or in influenza, all those can come in cyclical trend, whereas seasonal trend is all related to the changes in season. Ayushman Bharat is covering secondary and tertiary care hospital, both the secondary and tertiary care hospitals. Measuring the endemicity of malaria is spleen rate. NNT is equal to 1 by ARR. If it is in percentage, 100 by ARR. Cheopsis index. Cheopsis index is actually the flea rat flea, so it is spreading plague. So it is more means more this flea, rat flea, so more likelihood of plague. Open well policy means if it is applicable, then you can use, once opened you can use for 4 weeks. Bias in meta-analysis is publication bias. TT, okay, within 5 years nothing to be given, whereas 5 to 10 years, remember immunoglobulin is only given when it is a contaminated wound. You do not give in a clean wound. So 5 to 10 years and more than 10 years, you can, or if it is unknown means definitely you have to give full vaccination should be given. And others 5 to 10 or more than 10, 5 to 10 also you don't want to give because it gives protection for 10 years, we say like that. So more than 10 years, then you can give one single dose of toxoid, whereas full course you have to give if it is unknown. If it is a contaminated wound, definitely you have to give immunoglobulin when it is more than 10 years, then you have to give this immunoglobulin. Gobi FFF, that is actually given by UNICEF. Then chemotherapy drugs are discarded in, it is actually yellow bin. Do not need a pre-treatment before discarding for urine bags. Shimodsky layer, you have to remember it is on the slow sand filter, it is on the surface. So on the surface. This picture can be confusing, so I am giving you a mnemonic NOP. Suppose O means that's a center line. So N means that area everything is N, that means everything is negative. So if it is TN, FN, that means negative predictive value we are looking, and that line will be having maximum sensitivity also, that point in that left side. Then newborn stabilization unit and SNCU. SNCU is newborn care unit, special newborn care unit. So SNCU we know that is in the tertiary care. So newborn stabilization unit is in CHC. Incentives given under JSY, I am giving the mnemonic that 4 plus 6 equal to 10 and 6 plus 7 equal to 14 in urban and rural. So this, after studying you should know the mnemonic, that is urban, higher number give for rural area 14, so 10 for urban, and first number is for Asha worker, and the rest of the two there, that is from mother. And the first one is high performing state and then low performing state. So high performing state, that is actually saying 400, and in urban areas, rural area 600 for Asha worker, whereas for mother in urban area it can be 600 if it is a high performing state, and 1000 low performing state, and 700 high performing state and low performing state. Bigger number given for LPS, so 1400 for low performing state in rural area. Factory Act, again I am giving mnemonic 4.5, 48, 9, and you can 9, when you write it inverse it is 6, so 60. So in a day 4.5 hours, maximum 9 hours. In a week 48, maximum 60 hours a week. Biliary atresia most accurate is cholangiogram, intraoperative. Ionic monomer, so this is the order you have to remember. Ionic monomer dimer, non-ionic monomer dimer. So that ratio is 3:2, 6:2, that is 3:1, then again 3:1, and then 6:1. Next is PET scan and technetium scan. So PET scan you have to remember more energy, 511. Technetium scan 114 kilo electrovolt. Annihilation in PET scan. Baker's cyst. Baker's cyst, remember it's a medial head of gastrocnemius and semi-membranosus. Then lemon sign, meningoencephalocele. Respiratory changes in pregnancy. So So what is decreased is FER, that is FRC, ERV and RV, whereas what is nothing changing is VIR, that is VC, IRV and RR, respiratory rate. Then next is position in which posterior fossa surgery, Fowler's position. Whiff test is positive in Gardnerella vaginalis and Trichomonas. Semen analysis, if getting normal, one more time you can repeat. Then after 2 values, if it is again normal, next step is looking for FSH. Vulval cancer stages. So first year 1A, it is less than 2 cm and less than 1 mm depth. More than